Healthy Conversations is made possible through a grant from the William L. and Ruth T. Pendleton Memorial Fund.
Hello, I'm Larry Parsons. I'm a physician here at Yavapai Regional Medical Center. Now it's Dignity Health. And I am head of the Inpatient Palliative Medicine Service. So I'm a palliative physician. My background is actually, I'm triple boarded. I'm boarded in family medicine, in geriatrics, which I'm a dementia specialist as well. And I also did a fellowship in palliative medicine. So I'm board certified in palliative medicine. And I like to tell people what palliative medicine is. Some people have heard of it, but they don't know exactly what we do. And hopefully I'll make that clear. Essentially, we take care of people with serious illness. And what I mean by that is a life-limiting illness like cancer, end-stage heart disease, lung disease, brain disease, et cetera. It's a team approach, so we will get involved pharmacy, social work, nursing, et cetera, with our focus being people's quality of life and a holistic approach where we engage the family members and the friends and support system of a person. We look at all the realms in a person's not just their body. We engage in your spiritual realm, your psychosocial realm, your familial realm. So we look at the whole person essentially, because when people have serious illness, it impacts all of these things. And so that's what our focus is. And in the inpatient setting, in the hospital setting where I work, hospitalists or the doctors that are managing the care, or sometimes some of the specialists, heart doctors, emergency medicine doctors, will consult me to sit down with folks and help them understand what's going on with their medical care. And also what's important is to find out what type of care makes sense for this person. And let me talk about that just a little bit when I say what care makes sense for you. Because really, my specialty was created because of technology. Nowadays, we have so much technology. We have subspecialists. We literally have several different doctors for the eye, the back of the eye, the front of the eye, the whole eye. So with technology came all this subspecialization. It used to be you had a family doctor who would deliver you, who would take care of you, who would do your surgeries, all the way till, womb to tomb, so to speak. Well, that's not the case anymore. And what happened, what kind of got lost in that picture, is the physician who knew you, who knew what your faith was, who knew what your personality was, who knew your family members, right? And knew what was important to you. And now with the atomization of medicine, with so many different doctors you're going to, you don't really have that. And we realized in the medical realm, probably back in the 80s, that, you know what? We're missing something here. And that's really how my specialty came to be. Our focus is really being able to talk to people, get to know them, help them understand. So in one respect, I'm kind of a translator. The other thing is these kind of conversations, what's really going on with you, what are your options going forward, and what makes sense for you, those are not 5-minute conversations. Those conversations often take an hour or more. And different from other specialties, most specialties come into your room and they have some type of tube or something they're going to put into your body or your orifice or something. I come not with a tube. I come with time in my hand. I have the time to sit down with folks and get to know them a little bit, what's important to them, what's meaningful to them, what's their support system, how is this illness impacting them? Do they understand the full ramifications of the clinical situation? And, hey, what are your options going forward? What does it look like going down this road where you kind of have this surgery or that surgery versus not having that surgery? Okay? What makes sense to you? Are there other options? What do those look like? So that's what I do. I come with time in my hand, with my focus being, let's look at the whole picture and let's think about quality of life as well. So that's one of my major things. Sitting down, what are your goals? What are you hoping for? What makes sense for you for your health care? That's one thing. The second thing I'm trained in is good symptom management. I mean, oftentimes when you have serious illness, that comes with a burden of symptoms, whether that's pain, shortness of breath, weakness, fatigue, constipation. That's a big one. I'm a constipation doctor. Proudly I say that because it's a big deal and oftentimes it's missed by your eye specialist, so to speak, right? So I am an expert in symptom management in very seriously ill people. And so that's another thing that I can bring to the table to help folks, okay? Now, I know I've been kind of telling you what I do. In my experience, let me give you a personal example that kind of I have found helps people, clarify for people what exactly I do. I moved to Prescott, Arizona back in the summer of 2015. The reason I moved to Prescott is because, like I said earlier, I'm a dementia specialist as well. And I diagnosed my own father with dementia, early dementia, when I was visiting them in Arizona. They lived in southern Arizona. I'd visit them every year. And once I made that diagnosis, I went back to the Midwest where my other 3 siblings lived as well. And I said, guys, we all need to move to Arizona. We need to get jobs there. We need to get close to mom and dad because I know what's coming. We need to support them. And in fact, all of my siblings and myself, we all moved to Arizona. Before I moved, I said, Mom, Dad, would you be willing to move back up to Prescott? They lived in Prescott in the 80s. Because I didn't think my wife would want to live in the desert and I wanted to stay married. So I said, would you move up to Prescott if I moved there? And they said, yes. So I came here in the summer of 2015. And that Christmas, 2015, I thought, wow, we haven't been together for Christmas, my siblings and I and my parents, for years. Why don't we all come to my house in Prescott for Christmas? So I called up my folks, called up my siblings. We said, hey, great idea. So my folks came up Christmas Eve, and Christmas morning, my siblings were there. And that morning, the other thing I used to do is emergency medicine. I did that for 8 years. I thought my dad was having a heart attack. I know what a heart attack looks like. And I said, he was having chest discomfort, et cetera. And I said, Dad, we need to go to the emergency department. And my dad said, not going, kid. And he hates doctors. And didn't like go hospitals. I says, Dad, and I had my big, mean, ugly brother there, and he said, Dad, get in the truck, we're going to the hospital. And we took him to the hospital. He came with us. And we were in the emergency department for a couple of hours. They did some tests, and the doctor said, these tests are equivocal. We need to get one more troponin test, a blood test, to see if he's had a heart attack. A couple more hours, we'll do that, Larry. And I said, okay. So I went to my dad. I said, Dad, 2 more hours. We're going to get this one more blood test and we'll know for sure. And he said, son, that's going to be hard to do. I go, well, why is that, Dad? He goes, because I'm not going to be here in 2 hours. I'm leaving right now and I'm going back to your house. Ed, get the truck. I go, whoa, because my brother was there. I says, Dad, hold on. Listen, you can't go, Dad. You need to stay here. Just 2 more hours. Give me 2 more hours, Dad. And we get this test. And he said, son, I'm not doing it. I'm going to go right now. And then I put my mean doctor hat on. I said, listen, Dad, you need to listen to me. I says, if you go home to my house right now, Dad, you could die at my house today on Christmas Day. Do you understand me? And he says, now you listen to me, kid. Because I'm the youngest, he always called me kid. You listen to me, kid. He goes, I'm an old man, and I've had a great life. And I haven't had you kids together for Christmas for over 20 years. I'm having Christmas at your house today, son. And if I die, I'm okay with it. get the truck, Ed. Now, I did not agree with that, with my dad's decision. But I knew who my dad was, and I had to honor it because that's what made sense for him. I went to the ER doc. I said, look, Tara, I'm going to take you can't do that. I said, I'll sign everything, but this is what he wants. I took my dad home to my house that day before he got that other test. Now, if that had been my mother in the exact same situation, my mother would have definitely stayed. Well, do they do your nails here? I mean, I love to see, she's at hospitals all the time. She wants to die in a hospital. Not my dad. And if it had been my mother, she would have stayed there. So that's what I do. I sit down and say, what makes sense for you? Just as long as you know this is what this road looks like, this is what that road looks like. Who are you? What makes sense for you? And that's the key, because like I said, technology, we have a machine to do the work of every organ of your body. And for some people, that's okay. But for a lot of people, that's not okay. Because those interventions come with burden, with pain, being away, now especially with COVID, being away from your family where you can't visit. And that costs something, right? Not just money, that's not what that, it costs in your quality of life and who you are as a person. That's what I do. And I do that on the inpatient, and we also have an outpatient program, okay? That is people outside of the hospital. We have an office here right near the hospital on the West Campus. We have providers where they address the same thing. What's important to you? What's your goals of care? Make sure you have a medical power of attorney, so if you're so sick you can't speak for yourself, you have a designated person who knows you, who can speak on your behalf. So that's another fantastic program that we have in this is a small town. I come from a very big medical center back in the Midwest. We didn't even have a program like that. And yet YRMC felt that that was important for our community, and they went forward with it. So that's another incredible opportunity. I refer a lot of people from the hospital to our outpatient program. So that's essentially what I do. And again, the way I get involved in people's care in the hospital is other doctors ask me to do it. However, if you're in the hospital or a loved one is in the hospital, you can actually talk to the hospitalist caring for your loved one and request a palliative consultation, and I would be or one of my colleagues would be happy to come and assist you in your care. So that's what I do in a nutshell. And again, I'd be happy to address any questions that folks might have. Palliative medicine is kind of the big umbrella under which hospice fits, okay? So palliative medicine broadly takes care of people with serious illness, and that means those people can still be alive for a number of years, but they have a life-limiting illness. And those people may want to continue coming back and forth to the hospital, say getting chemotherapy, getting other interventions to fight against that life-limiting illness they have. And that's where our outpatient palliative team will help. Some people are closer to the end of life and they say, you know what? I don't want to keep coming back and forth to the hospital. I don't want to keep getting poked with needles. I just want to be comfortable. I want to actually die at home. I don't want to die in the hospital. And that's when we get hospice involved. Hospice is called the Medicare Hospice Benefit. It's through the government. And like any benefit from, like Social Security benefits, you have to qualify. There's two qualifying features for hospice. That is, number one, you're 65 years or older. And number two physicians believe that your illness will likely take your life within 6 months. That is a prognosis of 6 months or less. So for people who that's what makes sense to them, I don't want to come back to the hospital, I just want to be comfortable, I want to die at home, that's when I put hospice on the table for those folks. That's the difference. And again, the way we help folks is walk them through this and say, here's what the options, here's what's available. Let's listen to you and make sure we make sense of what makes sense for you, and that you understand what the doctors are saying by doing this procedure, that procedure, that procedure. What does that look like? What does that mean for your quality of life? How long does it take to rehab for that? All of those things, doctors don't typically do a great job of helping patients and families understand. So that's what I do. We're just another specialist, okay? So we work along with other specialists. So for instance, when I refer people to the outpatient palliative doctors, I always write a note to their family doctor and say, hey, Dr. whomever, I saw your patient, your John Doe here in the hospital. They felt our outpatient services might be helpful to them. Is it okay if we get involved in their care? And we communicate with all the different specialists. So we're specialists. Our specialty area is quality of life and good communications. So we're like the heart doctor, lung doctor. So you don't lose those doctors. We don't want to replace those doctors. We don't want to replace your family doctor. We're another specialty that concentrates on the big picture and what's important to people. There's a lot of people that have chronic illnesses that will end up being a serious illness that's taking their life. I would say for someone with COPD, if they start getting hospitalized, a couple times within a year, that's probably when it'd be helpful to get us involved. If the person's lung, care is, they're pretty stable, they're not going to the hospital, that's probably not the time to necessarily get us involved. But even if they do, we will sit down, make sure they have what their goals are, who's their medical power of attorney, and then say, here's our number, call us if XYZ happens. So at the very minimum, I would make sure that I'd have paperwork that said, who's the medical power of attorney? And that's basically saying, if I get so sick, or when I get to the place where I can't speak on my own behalf, who would I have do that for me? Who knows what my desires would be, at that time in my life? So number one, medical power of attorney paperwork. Number two, we really encourage people to talk about the type of care they would want at the end of life, okay? Do you want to be on machines, breathing machines or kidney machines, et cetera? If you died, would you want us to try to reverse that death and bring you back? Those are the basic things I would talk, that I think everybody needs to do. Also for people with dementia, early on dementia, I would say you need to start getting your family members involved and start planning ahead. What I see most common here in this community in particular, it's actually in any community that I've worked, is people don't do that planning, and then all of a sudden you get to the place where this person really can't be taken care of in the home, and then it becomes kind of like this, trying to herd cats, It's so planning ahead to say, what's going to happen when I can't live independently? What's that going to look like? So that's the type of thing I try to get families and patients to start working on. Oftentimes, as a palliative physician, what we do, we get pharmacy involved, especially in the outpatient, and we look at all the medications. And what you will find, and this is why really some of our care is critical, is because people see so many different doctors, they kind of accumulate all these different medications. And oftentimes these medications can impact your quality of life. And so we're there to kind of say, does that person really still need this ulcer medicine that they've been taking for 2 years and they don't have an ulcer, right? Because that has significant consequences. It can increase the chances of pneumonia. Some people say it can increase the chances of dementia because you can't absorb B12. So yeah, medications have side effects, and we're often involved really working with the other doctors and talking to them about that. We also talk to people about over-the-counter medications. Say, look, over-the-counter medications aren't necessarily benign. You have to be careful with them. So we're, especially in the outpatient realm, we're very, very big in people bringing in their medications and us going through them with them. So. Social workers are worth their weight in gold. We have a social worker involved with our outpatient program. Look, when you have serious illness, one of the things that we try to do is, number one, what's your support group, right? Number two, what are the resources you have to draw on to kind of help you going forward? Social workers that's what they do. They are kind of like the Radar O'Reillys, people over 50 know what I'm talking about, in getting the resources, right, in the community, knowing what those are, how do you apply for them? Because quite frankly, some of the resources, again, they're related to government resources. As you know, it's not easy to tap into these things sometimes. And the social workers really help with that department. This is a very important question, okay? And here's why. Every day in the hospital, I will be consulted on a patient who oftentimes is delirious, and a lot of people, sick people, get delirious. That is, their brain's not working really well, okay? So it's not dementia, it's this fluctuating, this kind of sudden onset fluctuating course where they don't eat well, they don't drink well. It's difficult for them to cooperate with people that are trying to help them. And they certainly have difficulty making really important medical decisions. And when I get involved with a patient and their family, oftentimes these people have not done living wills, do not have a medical power of attorney, and no one's really spoken with that person of what would make sense for that person toward the end of their life. Would they want to be on machines? Would they want to die in the hospital, et cetera? And oftentimes there'll be 4 different family members, a couple from California, someone from back east, and someone from someplace else, and they will come. And each kid has a different notion of what mom or dad would have wanted at this stage of the game. And the spouse will say, no, they wanted this, but then get influenced by the kids. And so oftentimes what I'm there is trying to say, whoa, let's sit down and let's think about what really makes sense here. And it often gets really, really messy, okay? I help with those messy conversations. The hospitalists, the specialists, other specialists don't have time for that. I do. And what I try to encourage people is to say, hey, this is why it's so important to plan ahead. Because I often tell people the last thing your mom or dad would want was to know that you kids are fighting with each other, saying hurtful words to each other because you're disagreeing on what type of care makes sense for that person at this time. This happens all the time. And so what's really important for us is helping family members get involved before the crisis hits and says, so that the patient who's ill clearly makes, hey, this is the type of care that would make sense for me at this time in my life. That covers a multitude of sins right there if you can do that. And when you don't do that, I guarantee you it's a tough situation. So that's a great question. In fact, folks out there, do your kids a favor. Do your living will, appoint a medical power of attorney, tell that medical power of attorney the type of care that would make sense for you at the end of life, okay? Do yourself, your children a favor. I can't emphasize that. That's a legacy right there. And if you could do that, it would be, I think you go a long way in keeping kind of the family together and in a loving way, not in a conflicting way. Again, I just thank you all for coming and watching. Again, there's a number of other videos on the YRMC Dignity Health Healthy Conversations section of the website. And I would encourage you to look at those as well. And again, if you're in the hospital or even outside the hospital, you have a loved one or yourself with serious illness, please consider our services. I think we can, most people say that we're helpful. So thanks.